real world. We need to get to understand what the real world is. And the way I've designed this whole lecture is try to speak about the most important things first, and then I'll talk about the other things. I know that your attention span may not be that long, or you may not understand. Normally in my lectures, I like when people stop me in between and ask me for clarification and try to explain that so that you understand the subsequent topics without missing out on the base. But in a webinar, sometimes that becomes difficult. So unless it's really very urgent, you just can't understand what I'm trying to say, you can stop me and ask me. But otherwise, there will be time at the end for talking about, for asking questions, and I'll try to address the questions that you have. So very often we feel that dementia is not is a normal part of aging. So as we grow old, we're going to forget, and that is dementia. We sometimes feel that dementia is not a major public health concern in India. Sometimes people feel all people with dementia are the same. And sometimes people feel that nothing much can be done once a person is diagnosed with dementia. That is kind of the end of the road, and now we just have to wait for the end of this individual. But is this really the real world? Actually, not. Dementia is not a normal part of aging. This is a disease like any other disease that we have, and this is something you need to understand. The person is not behaving in the way the person is behaving because he's trying to create confusion for you, he's trying to make it difficult for you. He's doing it because he cannot do it, he cannot remember, because the brain is not functioning that way. I'll try to explain to you why that happens. Dementia is definitely a major public concern in India. Unfortunately, it is not recognized as a major public health concern because people do not understand dementia as a disease. 90% of the people with dementia in India do not have a diagnosis, but they do have a problem. The caregivers are finding it very difficult to cope up with people with dementia and take care of them. But even if they go to a doctor, they don't really get a diagnosis of dementia. So that's the reason why we need to raise awareness on dementia. People need to know what it is and know that there is help available after the diagnosis of dementia. All people with dementia are the same? Definitely not. In fact, there is no person with dementia is the same as the other. The behavioral problems, the way that person reacts to the caregivers, the way the person reacts to medication, everything changes from one person to the other. And therefore, no person with dementia. So if you know to look after one person with dementia, does not mean you can do the same with the other people. A lot can be done, and this is the key message that I want to give you. A lot that can be done very creatively if you can diagnose people with dementia early and train the caregiver, you can improve the quality of life. As Larissa said, in the poster they mentioned that I am the expert as far as dementia is concerned. So that is another big myth. I am not an expert as far as dementia is concerned. The caregivers of people with dementia are the experts. They are looking after a person with dementia for 10 years, 12 years, 15 years sometimes. They are the ones who can get actually a PhD in dementia care. So they are the ones who can teach us. But the problem is, by the time they learn how to look after a person with dementia, it's like around 10 years, 12 years, and it takes a huge toll on themselves. It causes a lot of caregiver burnout. So we don't want caregivers to go through that whole experience of 10 years to be able to learn on how to take care of a person with dementia creatively. What I have done is only learned from some of the caregivers that we have been dealing with and try to help other caregivers do something similar. So this was a situation that happened with XYZ. So why don't you try this out and try to deal with the person with dementia? So a lot of what I'm trying to do as far as creative care is concerned is non-pharmacological intervention. So you have drug treatment, but you also have non-drug treatment. And let me be also honest with you, in 1 hour's time, it is not possible for me to cover up everything, but it will give you the basics that it is possible to improve the quality of life of a person with dementia if you're going to deal with them creatively. As I said before, some of the people, participants in this group are my colleagues who were with me on a trip from Kashmir who just came back. And so I thought I'd put the picture of the air hostess because she was trying to tell us on how we can save ourselves. And I don't know if you can remember what she was saying when the oxygen pressure drops, what you do. And she said the oxygen masks will come down. And if you have a child with you, what do you do? Do you put the mask for the child first or do you put for yourself? Yeah. So if the oxygen pressure drops and you have a child with you or someone else that you're looking after, you need to put the oxygen mask for yourself first and then put it for the others. The reason for this is that if you take care of yourself, only then can you take care of the others that you're taking care of. So this is the message that I want to give all the caregivers of people with dementia. Take care of your own health. If anything happens to you, you will not be able to do a good job looking after a person with dementia. So take care of your health first. Understand what is caregiver burnout. In today's lecture, I'll be trying to explain some things to you about caregiver burnout and try to make sure that it's addressed. Don't ignore it. Don't let it build up. As it builds up, some of the caregivers that we have are even suicidal. Most of the caregivers, unfortunately or fortunately, are women. The 80% of them are women. Many of them, and 50% of them, were spouses who themselves were quite old, and they also had other chronic ailments, and they were looking after people with dementia. So taking care of a person with dementia, the first tip that I would give you is take care of yourself. Caregivers should take care of yourselves if you're going to look after a person with dementia. This is the picture of Dr. Aloy Alzheimer. He was the one who first identified the what we call beta amyloid inside the brain of a person with Alzheimer's disease in a patient called Augusta. So the agenda for today is try to understand what is dementia, understand what is dementia care, the basic care tips for caregivers, and we want to see whether the caring creatively for a person with dementia, does it work or does it not work? So then, for example, when the COVID vaccine came, the first question that somebody asked, does that vaccine work or does not work? So we want to see the evidence. So is there evidence as far as care is concerned, creative care for people with dementia is concerned? Does it make an impact on the person with dementia? Does it make an impact on the caregivers? All this and more in today's lecture. So stay tuned. So let's start with the first point of the agenda, trying to understand what's happening inside the brain. Now, this slide may look like there are many things over there. You can see there are two basic things that could happen in the brain of a person with dementia. One is the deposition of what we call beta amyloid plaques, and the other is something called neurofibrillary tangles. Now, these are abnormal proteins that get deposited inside the brain, which clogs the part of the brain that transmits memory, one of the most primitive part of the brain, as a result of which the brain shrinks, the cells die. I'll show you a short video now. You'll get to understand what's happening inside the brain of a person with dementia. Can we see that video, Larissa?
Yes, Dr. Amit. I'll share my screen. Can you see my screen? Is it visible now?
Yes, ma'am.
Thank you.
Oh, yeah.
In healthy people, all sensations, movements, thoughts, memories, and feelings are the result of signals that pass through billions of nerve cells or neurons in the brain. Neurons constantly communicate with each other through electrical charges that travel down axons, causing the release of chemicals across tiny gaps to neighboring neurons. Other cells in the brain, such as astrocytes and microglia, clear away debris and help keep neurons healthy. In a person with Alzheimer's disease, the most basic form of dementia, toxic changes in the brain destroy this healthy balance. These changes may occur years, even decades, before the first signs of dementia. Researchers believe that this process involves two proteins, called beta amyloid and tau, which somehow become toxic to the brain. It appears that abnormal tau accumulates, eventually forming tangles inside neurons. And beta amyloid clumps into plaques, which slowly build up between neurons. As the level of amyloid reaches a tipping point, there is a rapid spread of tau throughout the brain. But
Larissa, can
tau
you
and
make that
beta
on screen?
amyloid may not be the only factors involved in Alzheimer's.
I can see the video, but it's in a small screen. I don't know if it's possible to put it on the main screen somehow.
Yes, I'll just try again. 1 minute. Huh?
You can play it from where it has stopped right now. It's not, you don't have to play it.
Yes. Okay. Some are saying that they can't see the video, so I'll try again.
Yeah.
Just a minute.
You can't, will carry on.
Is it visible now?
It's visible, but it's not on the. It's not a big screen. It's
In
just
healthy people, all sensations
highlight it.
Sorry.
Spotlight is the spotlight option. Yeah.
Okay, let me see. Your screen is still visible to others. Okay. Where is the spotlight option, doctor?
I don't know if there is one.
Yeah.
We do it with Zoom.
Okay, 1 second.
If it can't be, we'll carry on.
I'll just present
I'll
my
explain.
screen again.
Okay.
Now?
Yes.
You can see it now fully?
It's not coming. Yes.
movement,
Hello, you can tap.
other cells in the
to
brain,
enlarge it.
Yes, I had enlarged it earlier, but then because of that, you all can't see for some reason. I don't know why. Now it's visible,
No, no, we
right?
can see.
Now you can see? Okay. All right.
astrocytes, and microglia clear away debris and help keep neurons healthy. In a person with Alzheimer's disease, the most basic form of dementia, toxic changes in the brain destroy this healthy balance. These changes may occur years, even decades, before the first signs of dementia. Researchers believe that this process involves two proteins, called beta amyloid and tau, which somehow become toxic to the brain. It appears that abnormal tau accumulates, eventually forming tangles inside neurons. And beta amyloid clumps into plaques, which slowly build up between neurons. As the level of amyloid reaches a tipping point, there is a rapid spread of tau throughout the brain. But tau and beta amyloid may not be the only factors involved in Alzheimer's. Other changes that affect the brain may also play a role over time. The vascular system may fail to deliver sufficient blood and nutrients to the brain. The brain may lack the glucose needed to power its activity. Chronic inflammation sets in as microglial cells fail to clear away debris, and astrocytes react to distressed microglia. Eventually, neurons lose their ability to communicate. As neurons die, the brain shrinks, beginning in the hippocampus, a part of the brain important to learning and memory. People may begin to experience memory loss, impaired decision-making, and language problems. As more neurons die throughout the brain, a person with Alzheimer's gradually loses the ability to think, remember, make decisions, and function independently. Achieving a deeper understanding of the molecular and cellular mechanisms and how they may interact is vital to the development of effective therapies. Much progress has been made in identifying various underlying.
That was it, Dr. Amit.
That's fine. Yeah, coming back to my screen. Yeah, can you see my screen now? Is my screen seen, visible?
No, Dr.
No,
Amit.
no, not yet.
Oh, okay, this. Sure.
Yes, it's coming now.
So sorry for those technical glitches, but what you really saw in that film is the changes taking place in the brain. The reason why I want to put this is for people to understand that there are changes taking place inside the brain of a person with dementia, and that's why they're behaving in the way they're behaving. And the changes can take place in part of the brain that deals with language, can take place in part of the place that deals with memory, with orientation. So it can be different aspects that could be affected in a person with dementia. Externally, the person with dementia will look perfectly normal, will have a conversation with somebody, could be very friendly, sometimes very jovial. Um, but I will laugh about anything that goes wrong. So there will be like a person has a very good sense of humor, but memory will be affected, and this is progressive. So when does forgetfulness become a disease? Very often, we also could be forgetting. If you go to a marketplace and buy some fruits, and then suddenly you realize that you have forgotten to get the bag with apples in it. So but you go back and you remember that you bought the apples, and you go back and you can pick it up. A person with dementia will not remember that. So a lot of us forget. We forget where we put our mobiles. We can forget where we put our keys. But thinking, we do end up finding where we have put it. And but a person with dementia may not be able to do that. So when memory problems affect our activities of daily living, this is key to understand. Forgetfulness is not dementia, but if forgetfulness is to such an extent that it affects your activities of daily living, then we say that there could be a problem and could be a disease, and the person needs further investigation to know whether this is dementia. So forgetting which day it is and you remember it later, that is not dementia. But losing track of the date and time and the year altogether, saying that it is 1990, trying to say that it's December now and I'm feeling very cold, this must be winter. So that could be a sign of dementia. That is not normal aging. That's not normal forgetfulness. Sometimes forgetting which word to use, you may start a sentence and then you just don't get that key word that you want to do. That is normal. But troubles making a conversation altogether, starting a sentence and not knowing how to complete the sentence, that could be a sign of Alzheimer's disease or dementia. Losing things from time to time could be normal, but misplacing things often and not being able to find them, misplacing things, and suddenly you find that somebody has kept slippers in the fridge. So that is not normal aging. That's not normal misplacement. It is a sign of a disease, and that needs further investigation. So the point I'm making is that not all forgetfulness in older people is dementia, but you need to get the person evaluated. There could be various reasons for that forgetfulness, and the doctor could do evaluation and find out what that is. There are lots of benefits of identifying dementia earlier on. So what are the signs and symptoms? As I said, memory loss, and it's more recent memory loss, something that you have just done, you would forget. You just had breakfast and you would want to ask for breakfast again. And to completely, actually, the person, that memory or that person has had breakfast is wiped out and they will ask for breakfast again. Difficulty in performing familiar tasks, problems with language, disorientation to time and place. In fact, they get lost in their own house. They may get lost on the way to the toilet and not know where the washroom is and go to another room. And if there is some kind of an emergency, may have some kind of an accident there, and it could lead to a lot of problems in the family if they don't understand what is going on with the person with dementia. Poor or decreased judgment, misplacing things, as I said before, problems keeping track of things. If somebody was paying the bills, it might be difficult to remember whether he's paid the bill or not. Changes in mood and behavior, trouble with spatial relationships, and withdrawal from work and social activities. If an elder was always looking after grandchildren, was always excited about grandchildren coming close, now they're worried that they may do something wrong to that grandchild of theirs, and they keep away from that. The minute somebody who's very social, and then there's someone who's come to the house, they will go and hide inside because they feel sometimes they are out of place. They don't even know who the people are, though the people who have come up, people who you are very familiar with. So this can happen. I've sometimes used the word dementia and sometimes Alzheimer's disease. Now, it has to be very clear to some of you who are new to this concept that Alzheimer's disease is a type of dementia. The dementia is a term, it's an umbrella term for all those conditions where people forget. There could be hundreds of causes of dementia. The most common are Alzheimer's disease. Around 60% of all the dementias are due to Alzheimer's disease. That is the one that was identified with beta amyloid. Dr. Aloy Alzheimer's identified. But in the video, you saw something like vascular dementia. It's like a mini stroke that takes place in the brain. Less blood supply to the brain that deals with memory, and you can have vascular dementia. In a country like ours, where we have a large number of people with diabetes and hypertension and high cholesterol, vascular dementia causes around 20% of all the dementias. Dementia with Lewy bodies presents with dementia features, person forgets, but also Parkinson's disease features. So they'll have tremors, they'll have hallucinations, which is kind of very characteristic, a very difficult type of dementia to deal with. Frontotemporal dementias occur even earlier on. So a person at the age of 50 can have frontotemporal dementia. This is the frontal lobe and the temporal lobe of the brain which is affected. There could be a lot of personality changes in this individual. Somebody who's very mild and very polite could be very abusive if they have frontotemporal dementia. And there could be various other forms of dementia. The point I'm making, these are irreversible. Unfortunately, most of the types of dementias that we have are irreversible forms of dementia. But it does not mean that nothing can be done for them. We can still take care, we can improve the quality of life and improve the memory in people with dementia as well. COVID-19 had a horrible impact on people with dementia because the access to care, access to caregivers, and the fact that when they were working in a very rural area, there was the lockdowns that would take place once a person was identified with COVID, and there was a family where the person had dementia, and she was finding it very difficult to stay locked in that house, and so she would want to go out, but then she was exposed to COVID-19, and so how can she be allowed to go out? And so it was very difficult, and the family members were finding it very difficult to cope up in the COVID situation. It was difficult for them. They had family members who were sick, and in addition to that, a person with dementia. The message to the caregiver on how to deal with this situation, I think you need to understand what is person-centered care. You need to understand that you're dealing with a person and you're not dealing with a disease. So once you understand that you're dealing with a person, the whole approach to that person changes. The compassion, the engagement, the relationship, the well-being, the joy that you get from this kind of, and there's mixed feelings that I've got, or messages that I've got from caregivers of people with dementia. I must say that most of them were stressed and there was burnout and they're finding it difficult to cope up with people with dementia. But some of them, even daughter-in-laws, were telling me after I was looking after my mother-in-law, there was so much of blessings that I got in return, as a result of which the health problems that I have actually have improved. So there is positive kind of an impact on caregivers, and there could be a negative impact as well on caregivers. We see this very often, even when the person with dementia dies, the caregiver really it's a huge impact on the caregiver. That's a different kind of relationship. It's a love-hate type of relationship, but still the caregiver wants to look after that person with dementia, and it is very difficult situation for them to cope up with that. So what are the tips that the caregivers need to keep in mind? One thing you need to definitely keep in mind is a person with dementia will not be able to take their own medications. Though they may appear that they can take their medication, you ask them, have you taken the tablets? Yes, I've taken it. Don't worry, I will do it. But they can do it. Either they will take the dose, double dose, or triple dose, or keep taking the tablet because they've forgotten that they've taken it, or not take it and say that they have taken it. So they could be missing on the tablet. So it's always better to take, and the earlier you take control of the medications, the better it is. People still want to be independent, so you need to keep them independent. At the same time, make sure that you're keeping control of the person's medication. So that is key, because if you want them to improve with medications, then they have to take the medications. Remember, especially as we grow old, we have a number of other ailments. It could be diabetes and hypertension, and the whole long list of medication that somebody is taking. In addition to these medications for dementia, it could be a long list. You need to speak to your doctor to see what medication is really required. Only those medications that are really required, you need to take them, because there's a lot of drug interaction that could take place, and very often some of the medications that people take are really not required. So sit with the doctor to understand medication. There are medications available, but it's not the only. There is no cure as far as dementia is concerned as yet. So I usually advise people, but if you, for some reason, people cannot afford the medications because this is chronic treatment, I say there's nothing lost. The battle is not lost. Non-pharmacological management is equally good to the pharmacological management. So if you do all what I say creative care, try to improve the environment for a person with dementia, to improve the quality of life of that individual, you can still do much better. You can do as good as the medications. The key to creative care is good communication. As you can see from this picture, here you have a caregiver and a person with dementia. There are two pictures of that kind. In one, the person with dementia is very happy, the caregiver is very happy. In the other, the caregiver is very anxious and very intimidating, and the person with dementia, you can see the fright on that person's face, and obviously they're not cooperating, because the key to good care is good communication. Speak to the person in front of the person, speak to the person at the level of the person. Don't try to stand up very high and give orders. Don't shout. Maintain eye contact. Touch is important. So hold that person's hand in your hand while you're speaking to that person and giving instructions to them. Don't make the instructions very complicated. So 5 tips while you're looking or talking to someone with dementia is: one, diminish distraction. So if there is a television that is on, the news is going on, or some sport thing is going on, and a lot of noise there. The person with dementia will not be able to understand what you're saying, because in between with that noise there'll be distraction, and the person will lose attention and not be able to pick up what they're saying. So diminished distraction when you're talking to them. Converse one to one. More people equals to more confusion. So even if somebody sneezes in between, that will be kind of a distraction for that person. So you converse one to one, hold the person's hand. You know when you're doing eye contact that the person is listening to you. And so if the person is not listening to you, with touch, you'll be able to get the person's attention back and speak to them again. So keep things simple. Don't say go and brush your teeth, but you say let's go and brush our teeth. This is the take the toothbrush, and here's the toothpaste. Can you put the toothpaste on the toothbrush? So it should be small instructions depending on what stage of dementia the person is. Avoid argument. This is, you need to underline this thing. Avoid argument, because no one is going to win. The person with dementia will also argue back, but will not make sense, and the person will argue back. So just avoid arguments, avoid getting into that situation. Remember, sometimes you may feel, okay, even if I argued, I did have my weak moment, and I need to just, I need to vent out my anger, and I'll scream and shout, um, and even sometimes get physical. Sometimes that's what happens, and you feel that the person with dementia now cannot remember, so it's okay. But remember, that's not the case. The person with dementia will not remember what you said, that is true, but will remember that you have been arguing with him or with her. So keep that in mind while you're dealing with the person with dementia. Just keep talking. So don't think that because the person is not really responding to you, avoiding talking to that person will also make that person feel neglected. So keep talking to them, even if that person cannot talk to you. So keeping all these things in mind, we had started through the Dementia Society of Goa an outreach program called the Home Care Program. And in this program, we would visit homes and help people make the diagnosis of dementia, and the our care support team would follow up. And this is a program that we did with the WHO and with the Dementia Society of Goa and the Department of Preventive and Social Medicine. We first tried to understand what was the situation as far as care is concerned. So we realized that when I was doing my thesis photograph while I was doing my thesis, we realized that we had to raise awareness, because not many people knew what dementia was. We realized that care had to be in the home, because many of these people with dementia would not even go to the doctor, because if they go to the doctor, they don't get any help from that doctor. And they find it very difficult to take a person with dementia, sit in the queues, and then go and see the doctor. So it was really becoming difficult for them. They wanted a doctor to come home. So if the doctor comes home, it may not be affordable treatment. So how can we overcome that? It had to be person-centered care for a person with dementia, and definitely we saw that if we have to do anything for the person with dementia, we have to first do it for the caregivers of people with dementia. So we used a technique called snowballing. Not many people knew about dementia. So we went house to house, we spoke to Anganwadi workers, we spoke to health workers, and told them, this is what, we asked them, what is dementia? Is there anyone with dementia? They say, no, there is no one with dementia in my village. But if you ask them, is there an elder who's forgetting and is getting lost, is got down on the wrong bus stop, and you have to actually get them back, is getting lost inside their own house? Yes, they'll say so and so is having a problem. So from that, one person helped us identify someone else, and that's how we identified the people with dementia. And we developed a program called the Care Intervention. I put this mnemonic care just to help us understand or summarize what we had done. The K stands for C, was for caregiver. So caregiver help was something that was the most important. C also stands for chronic conditions. We also had to address the chronic conditions in a person with dementia. So a person with dementia will also have diabetes and hypertension. Very often this is ignored once the person has dementia, so they don't take the medications. Nobody goes and gets the evaluation for the sugar levels or the blood pressure, and that worsens the conditions. So you need to make sure that the chronic conditions are under control if you want to really improve the quality of life for the person with dementia. A in care stands for the activities of daily living. So things that a person could do on a daily basis, so brush their teeth, dress up. This is what we try to help the caregiver deal with. R is for reminiscence therapy or cognitive interventions for the person with dementia to try to improve their memory. And E is for the environment and education. E is the environment. We need to change the environment to make it safe for a person with dementia. So we would visit the house, our health worker would visit the house, and they would do an evaluation and assessment of what's there. Sometimes there is some wire, there is some carpet, there are some steps somewhere. So how we can actually improve the environment to make it safe for a person with dementia. Very often the bathrooms are unsafe. It could be, they may slip and fall. So if you could put some grab rails and things like that, would really improve the accessibility and the functional ability of a person with dementia. So this is how we try to improve that. First point, as I said, identify caregiver burnout, balance family support. Very often it is that one caregiver is looking after a person with dementia all the time. So once you go there and you tell other family members that I think it's time that you chip in as well and give the caregiver some time off. So the caregiver is not someone who will have to do cooking, who has to look after the person with dementia, or to do the studies of the children and do the shopping. So that becomes very difficult. If someone else can take up some of the responsibilities, uh, that makes a big difference for the caregiver. And we take the role of the caregiver for granted, and it's usually the woman who's looking after the person, and it's like it's your job to do it, and you just have to do it. So that becomes a problem, and that's what causes all the burnout. Help understand dementia. Unless they understand it, they will not be able to respond to it appropriately. Understand problem behaviors and how to deal with it. Ensure compliance with the medication. Making the home safe for a person with dementia. Nutrition assessment and advice, optimizing management of associated conditions like diabetes and hypertension, as I said, structuring the day, and building up the dementia support system. So this is what we try to do. Now, what are the common signs of caregiver burnout? Very often we had caregivers who said, life is not worth living. There are some of them who just want to leave the house and go. This is not what I asked for. So if somebody is easily flustered and frustrated, forgetful, and very foggy, very often it could be because they are woken up at night time because of the nighttime problems, and so they've not got sleep themselves, and they're very foggy and say that I myself am getting dementia. I myself am forgetting. So this is a very common complaint that the caregivers give us. They're quick to anger, extremely tired, uninterested in things that used to give them some joy, anxious or depressed, feeling hopeless or helpless. These are all signs of caregiver burnout. So they have to take a break from their caregiving. There has to be someone who has to intervene for them. Once they get back to normal, they'll be able to do a much better job. If the caregiver is burnt out, the same thing with doctors. The doctors are overstressed, like what happened when we were dealing with COVID. It was very difficult to give the best quality care for their patients. So if we address the burnout, we can improve the quality of care. Just to give you some examples. For example, if a person with dementia is having eating problem, we need to assess why is the person having eating problem. What have you given the person to eat? What time have you given? What's the temperature of the food? What is the type of food the person was eating earlier? So establish a routine, encourage self-feeding, serve familiar food, serve one food item at a time, encourage fluid intake. Do not neglect food. Because the person is not eating well, not giving them food, not giving them a balanced diet is going to be counterproductive. Sometimes it could be as simple as some person having a dental problem, as a result of which the minute the person puts some food in the mouth, they can't bite, there's pain. So you need to address that. The person with dementia may not be able to tell you that they have a dental problem. Sleep hygiene is something else that we always encourage. The person sleeps well, the person will behave very well. Very often, sometimes caregivers give people with dementia sleeping tablets in the daytime because they want to make it easier for them to do the rest of the work. But if they're going to sleep in the daytime, they're not going to sleep in the nighttime. So keep that in mind. Music and massage, restrict sleep during the day, light exercise and walk sometimes are very useful. Reduce caffeine. Sometimes, if there's a bathroom, you need to leave the bathroom light on and keep the door a little open so that the person eventually, the minute they get up, they know where to go. So that these things. So there are various, people with dementia have come up with various packages. There could be eating problems, dressing problems, toileting problems, sleep disturbances, bathing problems, communicating. They may be having hallucinations, maybe having repetitive behavior, maybe having clinging behavior to the caregiver. So it's like if that person is not there, they will start calling out for that person. The minute the person goes to the market or even just gets out of the house, they will start calling, "Where are you?" So it makes it very difficult for the caregiver. If they want a break, they want to do other work and they're not allowed to do that. So there are techniques on how we can deal with that, and that's what creative care is all about. We tried to evaluate this, and I spoke about evidence in the beginning. So I told you if there was a vaccine for COVID that was introduced, we asked what is the evidence. So we give the vaccine to some group and we don't give the vaccine to the other group and see whether the ones who got the vaccine are less likely to get COVID or not. So that gives us the evidence. A similar type of a study was done So there was a group of people who were given the interventions that I spoke about, the creative care intervention, and the other group was given the intervention after 6 months, and then we tried to evaluate what was the impact on the life of the person with dementia. So we can see here the number of deaths actually reduced. It was half the number. The ones who received the intervention had half the number of deaths as compared to the control arm, and we also saw that the stress levels in the caregiver had dramatically reduced. This is what, in statistics we call it was statistically significant levels. The behavioral problems in people with dementia had also decreased, which was very good uh, outcome. So a simple intervention like this, understanding what are the problems in the person with dementia, what are the issues in the caregiver, and trying to address it non-pharmacologically itself can make a huge impact on the person with dementia. Currently, we have around 50 million people worldwide living with dementia. In India alone, around 4 to 5 million people are estimated to have dementia. Unfortunately, most of them do not even have diagnosis. In the world, every 3 seconds, we have a new case of dementia. So that is the rapid rate at which this condition is rising. In the low and middle income countries where our life expectancy, the health, we are living longer. If you have a heart attack now, you can have a intervention and you can live a long life. You have cancer now, you can get treatment for it. So people are living longer, and this is happening at a very rapid rate in the low and middle income countries. As a result of which, number of cases of dementia in the low and middle income countries like ours now are also on the rise. The other problem that we are having, which I call the Picasso, or the big headache, is the Pika syndrome. Parents in India, children abroad. So this is a common feature that we have seen. The children abroad, they are earning well. They want to help their parents. Parents do not want to go abroad because they can't tolerate that the climate, and they want to be in their own house. But if they have dementia, then they find it very difficult to cope up with that. So this is definitely now becoming a major public health problem in this country, in the world, as acknowledged even by the World Health Organization. As Larissa was introducing, she mentioned about the Lancet paper that we had done. I just want to briefly tell you that the good news is that if you intervene early, we can postpone or even prevent around 40% of the cases of dementia. So instead of getting dementia at the age of 60, you could probably get it at the age of 80 or so. You can postpone. That makes a huge impact or a huge difference in your life and in your family. So what you need to increase? You need to increase education, and you need to increase education earlier on. So it's not about the age of 60 trying to read something and getting yourself a new degree or something, but before the age of 20, you need to focus on that education. Physical activity is very, very important. So if you stop doing physical activity, the blood flow decreases, as a result of which all the complications and the abnormal proteins get deposited inside the brain, as a result of which a person gets dementia. Social contact is very important. That's the reason why we started the memory cafe, is to just get people to meet each other. When you meet each other, remember things that you have said and continue with the conversation that you have. All this requires memory, and once you use it, or you lose it. So once you use it and have opportunities like this to use it, it helps you spark off new neurons. Now we've learned a lot about what is called neuroplasticity. So even if the cell dies, there are other neurons, that other pathways that can be made, but you need to make an effort to build those new pathways. You need to decrease hearing loss. We have realized that if a person is having a hearing loss, use a hearing aid. If you do not use a hearing aid, there is a rapid deterioration as far as cognition is concerned, because even in the hearing center is very close to the center that deals with memory. And so somehow we found a very close link with people who have deafness and cognitive decline. But if you use hearing aid, that it overcomes the decline in cognition. So it's always, we encourage people to use your hearing aid. Hypertension is a problem, so decrease the blood pressure. Make sure you try to aim for the 120/80 or 130/80 level of blood pressure. Obesity is a problem, so if you think you're obese, you need to do exercise. Try to reduce weight in any case. Smoking is a definite no-no to anybody. Depression could be a problem. There's a condition especially called depressive pseudodementia. So because you have depression, you may tend to forget. Sometimes when we are stressed out, we also forget. So that is depressive pseudodementia. If you treat depression, you can overcome this. Diabetes is a problem. Definitely need to detect diabetes. Take your treatment on time. Keep your diabetes under control. Excessive alcohol intake can cause dementia. Head injury can cause dementia. And now we've also realized that air pollution can cause dementia. Air pollution can cause heart disease. Air pollution now can also cause dementia. So if you decrease this, you can prevent dementia to quite an extent. Remember, the tip is use it or lose it. If you don't use your brain, you may end up losing some of the cells. The brain will feel, okay, I'm not required anymore, so let me not think and let me not remember. And then you're dealing with a situation where you can't form new memories. And the whole focus, these are pictures of, that some of you all are here. Sabrina, I can see this is a picture that we had. Uh, Earlier, we used to have these the memory cafe meet physically, but now because of COVID, we are having it on Zoom, and we have people from various parts of India joining in, and it's a platform to meet each other. It's a platform to do for cognitive therapy and to try to build memory, but in a very fun way. So this is a picture that I put here on the carnival theme of the memory cafe that we had, and we have it every Monday. So some of you who are interested to join the memory cafe, you can just message me and I'll put you on the group. It's a very fun. You love this memory cafe, and this is really actually what we call walk the talk. We say we need to keep ourselves cognitively stimulated. It's very easy for me to give this lecture, but we need to create opportunities like these, like the memory cafe, for people to come forward and actually connect with each other. Something else that had started is something called the Minded Initiative. This is for school children. So if you want to prevent dementia, you have to start off early. So educate school children on how to adopt brain healthy activities. The other benefit of the Minded program is when you educate school children, they have grandparents at home. They will tell Papa and Mama that, there is somebody who came and told us that memory problems in older people is dementia, and grandma is having some similar signs. Do you think that we should take grandma to a doctor to get this diagnosed? And they'll say, okay, maybe we should do that. So they can identify dementia earlier on. I felt that I used to do it for standard 7th and 8th first, but recently I did it for my son's class in 3rd and 4th standard, and they also picked it up very well. So it's very simple kind of an initiative, but I thought it is very impactful, and I think this needs to grow. These are various activities that are medical school graduates in occupational therapy and physiotherapy, and medical students participate in the World Alzheimer's Awareness Program. We have a run. We have various kinds of activities. This year, the Atal Setu was lit up in purple, which is the color for Alzheimer's disease, World Alzheimer's Day on the 21st of September. The whole idea is to bring out the message that we need to bridge the treatment gap as far as dementia is concerned. So as I said, many people are not getting the treatment, many people are not getting the diagnosis. We need to raise awareness, and all of you are going to be now champions of trying to raise this awareness. You'll be taking this message to other people that you see, and raise awareness on Alzheimer's disease. The ultimate goal is try to build what we say a very inclusive society, which is called a dementia-friendly community. So let us try to make our state a dementia-friendly community. Let us make our home a dementia-friendly home. Let us make our church a dementia-friendly church. Let us make our hospital a dementia-friendly hospital. Let us make a hotel maybe a dementia-friendly hotel. So if we do that, we can make the whole community dementia-friendly. For that, we need to start off with awareness. We'd also try to train the home nurses, and now they have various schools for home nursing in state of Goa. And so caregivers who would want external support or formal caregiving, the home nurses are trained in dementia care, so that can be done. We need to build the capacity of the home nurses further. I do understand that, but it's in process. There are a lot of other NGOs that also care. In fact, very recently, the Indian Association, Indian Medical Association has taken up the theme for the state of Goa as care of the old with the heart of gold. So they want to reach out to older people who have various problems, not only dementia, but Parkinson's, stroke, and other conditions as well. We have an umbrella organization for all the organizations. It's based in UK called the Alzheimer's Disease International. If you go to the website, you get a lot of information on how to take care. There are a lot of booklets available free of cost on how to take care of people with dementia, how to deal with problem behaviors and all these situations. So I would definitely advise you to go there. ARDSI is the Alzheimer's and Related Disorder Society of India. In Goa, we also have in Sangha, there is the Dementia Society of Goa. There is Cooj with Peter Castellino, which is the Mental Health Foundation. That they have a daycare center for people with dementia. So where you can avail the help. So the first step is to get a diagnosis of dementia. Understand that the life does not end with the diagnosis of dementia. There's a lot that can be done for the caregiver and for the person with dementia. You need to build what we call a care plan. You need to take one day at a time. Don't start worrying about various things. Don't think that it happened to XYZ, so it's going to happen to you, to your loved one as well. It may just not go that same way. Not everyone progresses at the same rate. Every person's dementia is different. If you keep in mind that my eyes do see, my ears do hear, I'm still me. So let's be clear. My memory may fade, my walk may slow, I'm me inside. Don't let me go. So if you understand that you're dealing with a person, you will be able to deal with the person with dementia in a much better manner. So this is all about creative care. I'm most happy to take questions from all of you, and thank you for your patient listening.
Thank you, Dr. Amit. That was very insightful and very nice of you to share so much of information with us. If anybody has questions, you can put on your mic and ask them directly, or you can type them in the chat box and I will raise them with Dr. Amit.
So hello everyone, can you hear me?
Yes, again.
So
You
my
can
name
mute
is
yourself.
Daniela D'Souza, and I'm joining you with my mother-in-law Olive D'Souza. We are from Dallas, Texas.
Yes,
And
Daniela.
first of all, thank you so much for this presentation. I would say that the timing is just perfect. So my mother-in-law. So first of all, to just borrow some terms that Dr. Dias used, we are part of the PICA. So this is the Parents in
Yes.
India, Children Abroad. And
I got that.
yes, and so I'm going to try and be brief, but I just wanted to share that whatever Dr. Amit Dias has shared about that there are and I might be using the wrong terms, that there are things you can do in your environment and the habits that can help slow down dementia is absolutely right. My mother-in-law has been with us for the past, I think, like 4 months, and we have taken other approaches rather than just focusing on drugs and medicine, but just changing things like sleep hygiene, introducing her to how to use the mobile phone, and challenging her to learn new things, and really challenging her to use her brain and use her brain more often to basically be comfortable with learning new apps and all that. So that we have seen has been very effective. And so I just want to commend all your work. And my mother-in-law is going to be back in Goa. She's looking forward to meeting you all. She'll be back in October. So
Great.
keep up the good work. Keep up the good work. You are doing amazing work. So thank you.
Thanks for sharing that, Daniela. And your mother-in-law actually called me up when she was with you all, and so I was very happy to hear that. It was very positive. And I still remember your father-in-law also called up and was was having an issue when these conditions were kind of developing earlier on, and but she's doing very well. So very happy for that. She's a very nice lady.
And I must tell you, she prays for you, and we pray for you every day because we are so grateful for a doctor like you who's focused on non-drug alternatives to addressing medical issues. So thank you again for your great work, and may God
As I
bless you.
said before, it is not me who's making a difference, it's you who's making the difference. You're the caregiver. You're the one who's doing everything. And I just take the credit for
Okay, that makes me feel better. Thank you. Okay, I will turn it over to the president. Thank you.
Yeah, thanks, Alan.
Dr. Amit, if you open the chat box, there are two questions there. Someone has asked, sir, does multitasking become a risk for the brain or is it good for the brain? That's from Gayatri Rajesh.
So, okay, very good question. So it all depends on how you can cope up with it. So a lot of people can multitask and don't get stressed about it. That's fine. But there are techniques of multitasking, and depends on how multi is your tasking. So if you can cope up with it, it's not a problem. But if it's causing stress, if that multitasking is affecting your sleep, if the multitasking is affecting the time that you would eat food, and is affecting your lifestyle, your exercise routine, etc., so then that is the problem. That can cause a problem. So stress can cause a problem. Multitasking by itself may even be good if you can be able to do. A lot of people can multitask, and so that it requires cognition to be able to remember things. That's kind of a memory exercise for you. But if it's causing stress, if it's going over a certain limit, that can cause a problem. Yeah.
Another question that's there is, if a person with dementia isn't eating well, how can we get him or her to share what exactly is the issue? Would they be able to tell us correctly?
So it all depends on what stage you are of that person. The person is. with dementia. So in the early stages, if you talk to them nicely, they'll be able to tell. The way we deal with it is try to find out what you are giving them to eat, what time was the person eating earlier. So the person was used to having lunch at 12 o'clock, and now you're giving it at some 2 o'clock because by the time the children come from school and everyone eats at 2 o'clock and you want them to eat together. Or you give them food, and the food, by the time they're eating it, it's cold now. So things like that could be affecting the meal. You may be that the person was eating fish curry rice, and now the food that they're giving is some pulao, good food, but it's different, or some pasta which they don't want to eat. So that could be an issue there. Or as I said, a dental problem could be an issue. So you have to evaluate it, give smaller meals, give them things that they like, and it tends to work out. Sometimes people feel like you mash everything up and give it to them, but that takes away when we see food, we need to smell food, we need to look at it, and only then we feel like eating. So give them that kind of pleasure of eating, and then they tend to eat better. But it's a trial and error type of a method, so you have to take and it's different for one person to the other person. But still, we always say don't make the person totally dependent on you. Don't say open your mouth and put the spoon in. Try to get them to eat on their own. Try to get them to fill their own plate. Um, in very moderate stages and late stages may be difficult. They may end up taking, say, suppose you have some fish, they'll take some 7-8 slices of fish. So they will not know how much to take and how much they need to be guided. But as far as possible, if you maintain independence, maintain dignity, communicate well, it is a difficult task. It is face-to-face task. So you just need to be there, which is the problem. And so that's why caregivers are called angels on earth. So, but if you understand the technique and you make it part of your life, it becomes much more simple. So you don't think that you're doing something different. This is how it is, and this is how you're going to deal with the person with dementia.
Thank you.
Similar problem, actually, sometimes you also face with children who are not eating, and so you need to kind of distract them and come up with various creative ways in trying to feed them. So it does happen with people with dementia as well. But they're not small children. They are people who know that they are adults, and they want to be treated as adults. They can't be treated like children. So that is the key difference that you need to understand. Though you need to be soft with them like you are soft with a child, but you can't be treating them like a child.
Okay. Thank you,
Yeah.
doctor, for that.
Matthew Upino has a question.
And before that, Anne-Marie Dias also talked about,
Okay.
Can you help with more non-pharmaceutical help, please?
Non-pharmacological methods. Yeah, each of the behavioral problems that we had identified has non-pharmacological interventions for that. If you go to the Alzheimer's Disease International website, there is a booklet on care for the caregivers, which gives you a very clear understanding of all of that. In a 1-hour lecture, it's difficult to cover up everything. And what we we don't overwhelm the caregiver with all the information, because that is too much for them. We try to identify what are the behavioral problems in a person with dementia that they're dealing with, and give them information only on those behavioral problems and only those the activities of daily living that they find it difficult to deal with. So that is the way forward. But go to the website, you'll get more information. If you contact me, I'm happy to give that to you as well.
Okay. Dr. Matthew Coutinho has talked about the challenges that he has come across, non-cooperation from family members who do not live with the person suffering from dementia. So the person acts so well when they arrive that the family then blames the caregivers for their caring rather than cooperating in establishing a good regimen.
Yes, it's a huge problem. But I know that it seems to be the story in many families where there is this split caregiving, and the ones who suddenly visit them once in a while will start criticizing the caregiver. The only person who's taking care of the person with dementia is that caregiver. Yes, I understand that person is also human. That person can make mistakes. And there is someone else who would come from outside and actually criticize that person. It becomes very difficult for the caregiver to deal with that. You need to find a nice way of dealing with people. The way we deal with it is to explain to the other family members as well. So the first thing that we do is not only explain to the patient about the diagnosed dementia, or the caregiver who comes to you in a clinic, but you need to explain it to the whole family and everybody involved in care, what it is to look after the person with dementia, and to understand what I mentioned in those 10 points. balance the family support. So that is very important. So once the family members also understand it, then their approach to the caregiver, people with dementia, or the respect for the caregiver with dementia would be different, and things could change. But there are good people, there are not so good people in the world, so it is difficult.
So I would just chime in here, and I'll just say that this is a term used actually by my sister. This was the time when my mom was unwell, and we were abroad, and she was caring for my mom. And we were tempted to give her advice, tell her to do these things different. And she was quite blunt, and she said, that's called remote control. And she was quite direct, and she said, that's remote control. If you want to take care, you come down here. So she's very direct, and I really respected that. So another thing, I'll just add two more things, is that the siblings who are not present there while you're caring for the family member, they may do two things. One, they may diminish your work, and I've had this I've heard from other friends where they compare caregiving for a senior with dementia with just caring for a child. They said, well, it's just like how you care for children. So that's a misnomer.
He
And the
didn't do
second
action
is
songs.
they do tend to give advice like, oh, why don't you
He
try
was
this
boring.
exercise? Why don't you try that? Well, the person in question may not have a good balance. So they want to give extra advice. And I think the best thing they can do is just listen and show some empathy.
Don't
So,
worry.
Yes, I think that's the right word. Empathy is
Now I
very
have to
important.
answer some questions. Okay, wait.
So this happens with the raising awareness. It's not only
I'm
raising
doing the
awareness in the
question answer
condition, but also
session.
the raising awareness in the
Go
care,
for
and the
bathroom
fact that
time.
we all are part of the care team. And even visitors need to understand that also part of the care team, and they need to, whatever they say is about improving the care of a person with dementia, and there are ways to do that. So they have to chip in physically and not really cause more stress for the caregiver when they're giving this advice. And empathy is very, very important. Empathy with the person with dementia and empathy with the caregiver as well.
Yes, there's one more question about whether there's been any change of late in the ratio of men and women having dementia.
Okay, the thing is, what we see is that women are living longer, as a result of which we are seeing more dementia in women. But this is like not only age related, but also aging related. And so we see a little smaller, small difference where we see more number of women who have dementia. The other problem that we notice is, which this could be a misnomer, what I'm saying, because if the husband has dementia, the wife takes care, she's younger and she takes care of the husband, and it's like as if it was normal aging, and she just controls everything. You just don't realize that the person has dementia to quite an extent. But the other way around, if the woman has dementia and she's the one who's actually cooking, and now she cannot do that and she cannot do all the other activities in the house, it gets noticed much more. And so you tend to diagnose dementia in women much more than dementia in men. As a result of which we tend to see that more women have dementia. But that could be it just could be a cover up. The men could also be having dementia, but it is like not does not come to the fore or does not come to our clinic very often. Could be. I don't know what your experience is on that.
Okay. Another question from Komu. How do we help dementia patients when they have mood swings and they show aggressive behavior or wandering about?
So these are two different behaviors. Actually, wandering is one behavior, and mood swings is another behavior. Mood swings could be if a person is very common in people with dementia. We usually see something called a sundowning effect. So towards the evening, there is a different kind of lighting changes. There are different shadows that are created inside your house, which you don't realize normally. But a person with dementia may start just picking up these black things somewhere, and they'll say, "Oh, there is someone over there," and they suddenly get afraid of something. Oh, somebody's coming there. He's there with a knife. So these kind of sundowning effect can take place, usually taking place in the evening. So we need to understand what is the reason for this mood swing. We can find out what the reason for the mood swing is, then we can try to address that. We can try to improve the lighting so that the shadows are not happening. Um, uh, and if the person is having depression, then we would try to give them treatment for the depression. So that is how you would deal with that. The other problem was wandering, as you said, and this is a big problem with people with dementia. Some people have wandering problems, some people don't have wandering problems. Usually they need exercise. And so once they have dementia, you wouldn't want them to go out on their own. So you would stop the exercise and stop them from going to the market and stop them from doing things. Sit inside the house, and it's they used to stay in a big house, and now you put them in a flat, and they're staying with you in a flat, and they find it very difficult. They want to move, because that is the urge that is there, which is they think they are 50 years old and they want to do what they were doing at the age of 50, or maybe even younger. Uh, taking a person for a walk sometimes helps that. So it drains energy and that kind of but take them to a place that is safe. So sometimes they may have a fall. So it is also somebody will have to be with them, for a walk, and a little brisk walking if possible. So if that drains that energy off and the urge for wandering, it can help. Two, you need to understand the person is having this wandering behavior. You have to lock the doors. You have to lock the gate. Um, Sometimes if they see a lock, they want to open it. The minute they see a lock, they would want to go and open the tabling on that metal and not going to keep the business. Those kind of things can happen. So what we do, we put a lock and we put a piece of cloth in that, so that person does not see a lock. They don't see a lock, that's fine. If they see a lock, they would want to know what is the lock doing there on my door. Why am I being stopped from going out? So these things can happen. Simple. It may sound very crazy, but these are things that practical things that actually work sometimes.
Thank you for those detailed explanations, Dr. Amit. One person in the beginning had asked whether it would be okay for you to share your contact number. So, do you mind if I share it with the group?
Yeah, sure.
So, I'll put it into the chat box then, with your permission. Yes.
Yeah. If you have any, at the Goa Medical College, we have the Department of Neurology, which would look after people with dementia. There is the IPHP at the psychiatric hospital. You can go. The treatment is available free of cost over there. The assessments and the scans, etc. Because we need to rule out the reversible forms of dementia when we are trying to address the problem. So these things are done. The full workup is done, and you can get help. Yeah, but keep in mind non-pharmacological methods as well. Doctors usually have very little time with you, and so it's very easy for them to write a prescription. Take this once a day, or take this twice a day, or whatever, and this come back after a month. But you need to understand what the problem behaviors are and how to deal with that, and that is the real way forward in creative caring for people with dementia.
Thank you, Dr. Amit. If there are no more questions, and yes, many people are appreciating. You're welcome to give your feedback in the chat box or directly to Dr. Amit if you also please. And I would like to invite Mahira to address the vote of thanks, please.
Yes, ma'am. On behalf of the Principal Dr. Mahesh Pai, Program Coordinator Ms. Larissa Rodriguez, the staff and students of Goa College of Home Science, and all our other participants here today, I would like to thank Dr. Amit for this very creative session on caring for people with Alzheimer's disease and dementia. It was a very enriching and insightful session. Dr. Amit conveyed the topic to us in a very simple way by starting off with bursting some myths, then explaining the science behind dementia, and also focusing on the positive and negative impacts on the caregiver. Although dementia is irreversible and there is no treatment, Dr. Amit gave us tips on how to improve the quality of life of the people with dementia, and also emphasized on how we should change our approach towards the person. He also shared some of his work and steps taken by him, and it has really inspired us. And I'm sure it will be of great help, not just practically, but also in making us more understanding and compassionate towards those living with this condition, and also those involved in the caregiving. And let's not forget, the ultimate goal is to build dementia-friendly communities, and that starts by creating awareness. We are grateful to you, Dr. Amit, for sharing your time, knowledge, and experience with us. Thank you so much.
Thanks, Mahira. That's a very good summary of everything. And thanks for everyone for the feedback. Thanks, Larissa, for inviting me. I really thank my dean, Dr. Bandekar, who has given me permission to speak to you all, which I'm very grateful to him for all the support that I get from the medical college and the government of Goa for the work that I do. So thank you all. It was wonderful speaking to you, and thanks for the sharing. If anyone wants to contact me privately also, you can do that, and I'm most happy to help you out whenever I can.
Thank you very much, Dr. Amit, and we hope to see you again for another session sometime soon.
Sure.
Thank you everyone for attending. God bless you all.
Thank you everyone.
Bye-bye. Good night and have a lovely evening.
Good. Very happy. Bye everyone.
Huh? Yeah. What happened? That black one is there. Card number. It's in where? Okay, use that. Use. Use it, child. Okay, I'm going now for practice, okay? So please excuse me. I'm late. I'm late today, no, child? Sweetheart. Use, Mama.